This is my supplemental oxygen checkup. Some cases you might need the use of supplemental oxygen to get a higher concentration or flow rate of oxygen to the patient. It's usually needed in cases of hypoxia, shock, little or obstructed blood flow, as well as like not enough hemoglobin, so like anemia situations. Your instructions for assembling the oxygen tank would be to assume your BSI precautions. Some of the stuff you can do ahead of time, such as getting the oxygen tank, placing it upright, slightly open the cylinder to remove debris, selecting the pressure regulator. We already have one on here, and typically some of them do come with them already on there. But you do want to make sure you inspect the pressure regulator, you attach it, you inspect the level of oxygen in your tank by opening the cylinder. It'll tell you how much oxygen you have in there. You obviously want to make sure that it's full or has adequate supplies of oxygen. You're going to attach the hose, which I already did. Then you're going to attach your delivery device. So there's multiple ones that you can use. We're just going to use this one for now. This is your NRB mask. Here it just has a little prong that you can attach your supplemental oxygen hose to, and then you're going to inspect that you're going to turn it to your delivery settings, and then you're going to verify that there's oxygen flowing out, and then you're going to apply. You're going to get informed consent from your athlete, especially if they're conscious. You just want to make sure that they're not going to freak out, or just kind of explain to them that this is only oxygen in there, so they're not expecting something else. You're going to verify that there's oxygen flowing out of there, and then you're going to apply it. So this, like I said, is your NRB mask. And to use one of these, you're going to get the appropriate size. Typically, as athletic trainers, you're really only going to be dealing with a certain age group, so you really only need a couple sizes anyways. But like EMS personnel are going to have multiple sizes. Then you're going to allow it to fill up with oxygen. You're going to grasp the mask with the hand, like I did. Pull the string, put it on their face, secure it, get that tight seal, and then put the band over the head. The recommended flow rate for this is 10 to 15 liters per minute, no more than 15 liters per minute. And then your concentration is going to be anywhere from 30 to 40 or 50 to 60, depending on the situation. Then we don't have it here, but we do have a nasal one that you can do. In that it's just tubing basically. So it's going to be an extension onto the supplemental oxygen hose that you're going to put the prongs up their nose, so they're directly getting the oxygen flow up there. Then you're going to wrap it around the ears and behind the head and down the chest or wherever the oxygen tank may be. For that, you're going to want to do 1 to 4 liters per minute and 24 to 36% oxygen. That is just because you don't want to cause any nosebleeds or dry out their nostrils from the high concentrations of oxygen. Another one that we can use is a resuscitation mask, which is similar to the NRB, but typically you can connect it to a bag valve mask. In this, you're going to put the apex of the mask on their nose, like on the bridge of their nose there. And the bottom one you're going to put along their chin or their lower lip to create a seal around it. They're going to have your thumb on the top, fingers on the bottom. You can connect it through here. There's a little attachment there. And that just makes sure that you're getting a higher concentration of oxygen. Typically it's going to be 10 to 15 liters per minute at anywhere from 30 to 60% of oxygen. Some things that you want to be careful of when you are providing supplemental oxygen is you always want to keep monitoring their vitals, making sure that they're getting the air in, making sure that they have an adequate blood flow. By the time you use your supplemental oxygen, you should have already activated your EAP as well as the EMS, so that they should be on the way. You want to continue this until the EMS arrive and that they can, hand over the situation to advanced medical personnel. Another thing you want to keep in mind is your oxygen is flammable, so you don't want to do it in any like high temperatures or expose it to an excessive amount of heat. You don't want to leave it on, so if your patient is not using it, obviously you don't want to be leaving your oxygen tank on. So you want to discontinue use of the oxygen as soon as they're not using it. And then you don't want to administer too high of a flow rate or too high of oxygen concentration, because you don't want to dry out the patient with that constant airflow in it.